Hi, today I'm talking to Kate Blackett. Kate is an optometrist who studied optometry at the University of Auckland in 2007, where she graduated with first-class honours, and she's also therapeutically qualified. Kate later returned to the university to complete a clinical Masters of Optometry. Kate also went to Canada, where she completed a bridging program and board exams to be able to practice optometry in Canada. Kate then returned to New Zealand, where she worked as a clinical supervisor at the University of Auckland for 4 years. She has now got 2 beautiful children, and she works in New Plymouth at Judd Opticians. Hi Kate, thanks for joining me today. So today we have a couple of questions, and I was just wondering if you could answer them for us, for our viewers. So our first question is, what is in general the development of a baby's eye between the ages of 0 and 2 years old?
Okay, so the vision in a child or of a newborn does take time to develop, much like a child or baby needs to learn to walk and talk. They also need to learn to see. So in the first few weeks of life, a baby doesn't see in much detail. So their first view of life is kind of blurry, unfocused, grey, hazy. Their primary focus is about appearance space, so 25 to 30 centimetres. So that's why you might find that your newborn kind of looks up at you, kind of blurry, staring at you. And it isn't until around about 8 weeks where a baby can focus reasonably easily at appearance space or those around them. And up until this time as well, a baby's eyes are quite uncoordinated. So you might find that one eye kind of drifts in or out, and this usually is normal. However, if this eye turn is quite constant, or you've got a family history of an eye turn, you really do need to get your baby's eyes checked. But their eyes will become kind of more coordinated around 3 months. So at 3 months, your baby should be able to generally track a moving object reasonably accurately. They should be able to reach out for toys, and they should be able to look at one object to the other, so they can work out that 2 objects are separate objects, which they can't do at birth. Depth perception then usually starts developing. So depth perception is the ability to judge differences in space, or different distances of objects. So around 5 months, depth perception, which is the ability to judge distance between 2 objects, starts to develop. So a child will start getting their first taste or experience of 3D vision. Around this time as well, it is thought that colour vision is fully developed, so your child or baby will be able to see in colour. From there, vision, focusing, coordination of the eyes rapidly improves. And around about 10 months, a baby will be able to grasp tiny things with their thumb and forefinger. So you might find them going around on the floor, picking up tiny bits of fluff or staring intently at them. Then about age 1, babies can judge distances fairly well, so that's improved more. And by age 2, a child's hand-eye coordination will be extremely good, or should be good, and their depth perception will be developed well. And it is thought that their clarity of vision is pretty similar to that of an adult.
Right. That's pretty fast development from 0 to 2 years old then, in a very complex organ. So what are some signs that parents should be looking out for in those years of the first years that could be a vision problem, or something that parents can all just look out for at home?
Sure. So one that's quite common, and I get parents ask me about this a lot and bring their babies in, is crusty eyes or watery eyes. So this can be caused by usually one of two things. So either a blocked tear duct or an infection. So a blocked tear duct is common. What you'll find is your baby will have crusty eyes, one or maybe both eyes, and the eyes will water. What you'll find with a blocked tear duct is the white of the eye won't usually be red, so it will remain white. And as I said, it can either be in just the one eye or both eyes. So if you do think your baby has a blocked tear duct, it will usually resolve on its own, definitely by age 1, usually before that. What you can do at home is just use a face cloth or a warm flannel just to wipe away the crust. And you can apply gentle pressure just to where the tear duct is. So gentle pressure so you can gently roll in from where the tear duct is in towards the nose. So that can just help clear the blocked tear duct.
Cool.
So the other cause of crusty red eyes can be an eye infection. So an eye infection is common in babies and extremely common in toddlers as well, once they start going to preschool, daycare or kindy. So with an eye infection, you'll often have the crustiness, watery eyes. It'll sometimes start in one eye, but then due to the contagious nature will usually move to the other eye as well. And what you will find is the white part of the eye could probably be red, and if you pull down their eyelid, their lower eyelid, you'll find that's quite red and might also have a little bit of a bumpy appearance. So an eye infection, you really do need to get this seen to. So an optometrist is a good place to go. And you may need antibiotics for your baby or child's eyes if it's caused by bacteria. Can also be caused by a virus, which then there isn't any treatment, but just, with time. So then less common eye problem would be a turned eye. So I talked about that previously. So if the eye is constantly turning in or out, sometimes even up or down, or you've got a family history, you need to get that seen to. The child may need glasses or they may need eye surgery. So the optometrist would be able to refer you appropriately to an eye surgeon if needed. Less commonly, a child can be extremely light sensitive, so don't want to open their eyes, always kind of shutting them. This is very uncommon, but it can indicate elevated pressure in the eye, so that needs to be seen to straight away. And another uncommon condition in the eye is when you notice that their pupil reflex is white. So this can be picked up when taking photographs of your child. So a white pupil can indicate cataract in the eye or an eye cancer. So both conditions that need to be seen. And again, you can bring your baby to the optometrist, doctor, and they'll refer them appropriately to an eye specialist.
So if I saw a white pupil in some of the photos of my children, would that be something that you want to go and see an optometrist within like a week or a month, or is it like that day you need to go and see someone?
Yeah, so that's one of the more serious conditions. So you would want to go and see someone pretty much as soon as possible.
Okay, cool. And what are some things that parents can do throughout their child's early life to help with vision development?
Okay, so from about birth to 4 months, you want to be stimulating that focus area that a child is looking at, so that kind of 20 to 30 centimetres. So putting toys within reach, so within 20 to 30 centimetres for them to look at and try and reach to. So when you're feeding your baby, you can move positions or places in the room or go to different rooms. If you're breastfeeding, maybe changing the side that you're feeding, just to give their visual system other things to stimulate them.
Right.
So
and what else can they do? What else can we do as parents trying to help?
So from about 5 to 8 months, your child, giving them lots of time to explore, so putting them under a play gym, so they can kind of grab toys, kick, move around, giving them lots of time to explore on the floor, singing some that have kind of actions with them, so moving their hands with the actions, so they can get used to watching your hands or their hands move. From 9 to 12 months, you can play hide and seek or peekaboo games with your baby, and this will help them develop visual memory.
Right.
Giving them lots of time to crawl around or roll around on the floor to explore again, looking at different visual stimulation. And again, naming objects when you're talking to your child or reading them books. So this will start helping with word association and their vocabulary. From about 1 to 2 years, playing things like rolling a ball back and forward, that can help them with visual tracking. Giving the child building blocks to build towers, or playing with balls to help with their fine motor skills. And then reading them books or telling them stories can help them build visualization.
And what does that help with their eye coordination, all of those things? Like, does that help their eyes move together and help development that way?
Yeah, all of those things. So it's going to improve the coordination of their eyes, the focusing of their eyes, as well as build a lot of other essential developmental skills, not only visually. So doing those sorts of things will help the coordination of their eyes, the focusing of their eyes. Also helps other developmental things like fine motor skills and other senses. Right.
So when should we take our baby or toddler to get their eyes tested by an optometrist?
Okay, so if you've got a family history of what we call a strabismus, which is where you've got an eye turn, high prescriptions, so if someone in your family wears very thick glasses, or glasses that from a very young age, amblyopia, so amblyopia is where the vision doesn't develop fully in one of the eyes, or just vision problems in the family. In those cases, we recommend you getting your baby's eyes checked at 6 months. And you don't need to worry that the baby can't respond, because we do tailor our eye tests based on the child or baby's age, and we do use special equipment in those circumstances. So it is worthwhile checking that your optometrist can check children of that age and finding someone that can. So if you don't have any of those conditions in the family, we recommend that by age 3, getting a full eye exam by an optometrist. And then from there, before they go to school, so around 5 years, and then every 2 years after that, or as required. So those are the New Zealand Association of Optometrists guidelines.
Okay, cool. So what would happen if I've taken my baby or child to the optometrist and then there was something that maybe needed to be further looked into, like it had one of those eye turns that you were talking about or something like that? What would happen then?
So as optometrists, we work closely with eye specialists or ophthalmologists. So if required, we would be referring your child to the ophthalmologist and working with them to determine what your child needs.
Great. Okay, so thank you so much for chatting with us today, Kate, and I hope that everyone has found something a little bit interesting or helpful about eyes and optometry and optometrists and what they do. So thanks very much for chatting.
Thank you.
Cool. See you later.
Bye.